Begin to talk to us about this. Omer Awan joins us, professor at the University of Maryland School of Medicine. Welcome, doctor. I said I had to, we're all doing like triple take sauerkraut, really? And then there's this debate. It's one of those foods, by the way. I'm not a sauerkraut guy. People either love sauerkraut or they hate it, I've noticed, because I've been asking people about it today. But should we be eating it? What are the pros and cons of sauerkraut?
Well, there's definitely positives and health benefits to sauerkraut and fermented foods, for that matter. Okay. They tend to positively affect our health gut microbiome, which is the environment that our gut is surrounded by, and that can aid in digestion, that can decrease inflammation, and that can certainly bolster our immune system. And that inflammation is key because that inflammation is a common pathway for a lot of chronic medical conditions like heart disease, type 2 diabetes, even cancer. And as we know, Secretary Kennedy has made his mission to curb the chronic medical disease epidemic here in America. So that's probably why he's touting this. But with that said, there are concerns, and the concerns are that there isn't a lot of robust data about the benefits for fermented foods. Many of the studies are very small. They only enroll a dozen or 2 dozen patients, which makes some of the results skeptical. And also, there's not a long-term data on how these foods will affect health for the long term, like decades from now. So that's an important consideration. And the other is that these aren't for everyone. You know, some of these foods, like sauerkraut, for example, as you mentioned, are high in sodium, and that can lead to fluid retention. So if you have heart disease or chronic kidney disease, for example, that can be a problem, and that can exacerbate symptoms. So certainly not something that everyone should be trying.
Well, isn't all this stuff, everything in moderation and all that kind of thing, that you're not just eating sauerkraut with every meal? I mean, isn't that true just like literally everything?
100%. Moderation is the key here, and sauerkraut can be part of the diet, but it shouldn't be the only thing that you're taking, right? Really, what we should be striving for is healthy amounts of proteins, vegetables, fruits, whole grains, even healthy fats. All these things in unison provide the vitamins, nutrients, and minerals that are necessary for us to stay healthy.
What do you think is some of the general advice? You mentioned RFK Jr. that we're hearing out of this administration. So, I'm assuming not drinking alcohol is probably not a bad idea, right? But some of the other stuff in terms of how much red meat and all this kind of thing, what do you make of the general guidelines, absent sauerkraut?
Well, first of all, I would say alcohol, it's great that he's touting not to drink alcohol because, alcohol has been now shown with time to have no health benefits. Now the American Public Health Association has said that.
These always be those studies, a glass of wine, and it was just kind of people trying to convince themselves, I think.
Absolutely. So, linked to many cancers, not a good thing to do, even in moderation. And, sugary foods, ultra-processed foods, great that, Secretary Kennedy is fighting against those because those can lead to many chronic medical conditions. The key is balance. It's always balance, right? Taking a little bit of everything, trying to make sure that we get a lot of fruits, vegetables, whole grains on our plates. These are the things that allow us to stay healthy, not to give us nutritional deficiencies, and to allow us to have different things. It's kind of like planting a forest, right? Like having a rainforest and only putting one type of tree. That's not a rainforest, right? You need to have a diverse array of plants for that rainforest to be successful.
It makes sense. Like I was talking about those fad diets, like, when I was introducing you, I mean, that's the thing, right, with some of those. I mean, and some people swear by some of that stuff.
Yeah, people can swear by them, but the science tells us otherwise, right?
Right,
and the evidence
because they're out of balance in many cases.
Absolutely. We rely on what the evidence shows and what has been proven through science and through time. And what has been shown through time is that balance and a diverse array of foods is really what allows us to stay healthy in the long run. Now, a lot of these people, like Secretary Kennedy, have said that it's trimmed their waistline. And it may be true that sauerkraut is high in fiber, which keeps you full longer. It's low in calories. That may contribute to having a lower waistline. But the reality is it's due to a caloric deficit. If you're eating less than you're supposed to, you're going to lose weight. If you're supposed to only take 2,000 calories and you're taking 1,500 calories, you're going to lose weight regardless of what you eat.
Makes sense. I think that's important. What do you put on a hot dog, by the way? So, if you have a hot dog?
Listen, I put ketchup and mustard. That may not be the most healthy thing to do.
Fun. I don't eat a lot of hot dogs anymore, but I'm a ketchup guy, and people make fun. But never sauerkraut.
I am too. Moderation is key, again, as you had said, Connell. So, if you drink it once, eat it once in a while, it's probably okay.
Yeah. The president's a big ketchup guy, by the way. Put ketchup on everything, apparently. Dr. Omer Awan, thank you very much. That's the discussion of the day right there on the sauerkraut. I'm Connell McShane. We're live at 5.